Good afternoon. The date is November 9th, 2022. The time is 2:00 p.m. and I call to order this Health, Education, and Welfare Committee. We will have our invocation by Representative Mary Crawford. Please stand if you're able. Middle Representative Crawford. Roll call by Legislative Clerk April Lindsay.
Mary Crawford.
Yalega.
Joyce Deere.
Alega.
Leonard Gouge.
Here.
Robert Huff.
Present.
Anna Marshall.
Present.
Madam Chair, you got 5 present and 0 absent.
5 present and 0 absent constitutes a quorum. All business conducted will be official. The next item on our agenda is the approval of minutes of October 12th, 2022. I will give the committee a moment, and when they are ready, I will be ready for a motion.
I make a motion to approve our minutes with any necessary changes.
Representative Crawford, is that you?
Yes.
Could you make sure your mic's on? I could barely hear you. Representative Crawford has made a motion to approve the minutes. Is there a second?
Second.
Second by Representative Marshall. Roll call vote, please.
Mary Crawford.
Yes.
Anna Marshall.
Yes.
Leonard Gouge.
Yes.
Robert Huff.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The minutes of October 12th, 2022 are approved. Our order of business, the first item is TR 22-163, a tribal resolution of the Muskogee Creek Nation authorizing the principal chief to execute a contract with RMM Plus for the benefit of the Muskogee Creek Nation Department of Health. Sponsor Robert Huft.
Motion to pass.
We have a motion for a due pass from Representative Huft. Is there a second?
Second.
Second by Representative Gouge. Discussion.
Yes, Mr. Terry on.
Mr. Terry, yes.
Thank you, Madam Chair. This resolution is to address a piece of software with our RM Plus. It is a safety and security software that just strengthens our system. It's a sovereignty language and indemnification clauses. I think the total price tag on this software is about $4,000. I'd be happy to answer any questions.
Does the committee have any questions for Mr. Terry? Hearing none, are there questions from the council online or council in attendance? Hearing none, roll call vote, please.
Robert Huff.
Yes.
Mary Crawford.
Yes.
Anna Marshall.
Yes.
Leonard Gouge.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. TR 22-163 is passed. Next is NCA 22-139, a law of the Muskogee Creek Nation authorizing the expenditure of grant funds awarded from the Oklahoma District Attorney's Office, DAC, Victims of Crime Act, VOCA grant. Sponsor Robert Huft.
Motion to pass.
I have a motion for a due pass from Representative Huft. Is there a second?
Second.
Second from Representative Gouge. Discussion.
Mr. Terry, please.
Mr. Terry.
Thank you, Madam Chair. Thank you, Representative Huff. This money is going to provide direct service to victims of crime, specifically inside our same grant. So it will be defined as those efforts that one responds to the emotional and physical needs of crime victims, to assist primary and secondary victims of crime to stabilize their lives after a victimization, and three, assess victims to understand and participate in the criminal justice system, and four, provide the victims of crime with a measure of safety and security. And I believe this is also in a partnership with the Family Violence Program as well. I'd be happy to answer any questions.
Are there any questions from the committee for Mr. Terry? Are there any questions from council online or in attendance? Hearing none, roll call vote, please.
Robert Huff,
Yes.
Mary Crawford,
Yes.
Anna Marshall,
Yes.
Leonard Gouch.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. NCA 22-139 is passed. NCA 22-140, a law of the Muskogee Creek Nation authorizing the expenditure of grant funds awarded from the Oklahoma Healthcare Authority. Money follows the person tribal initiative grant. Sponsor Robert Huff.
Motion to pass.
I have a motion for a due pass from Representative Huff. Is there a second?
Second.
Second from Representative Gouge. Discussion.
Mr. Terry, please.
Mr. Terry.
Thank you, Madam Chair. Thank you, Representative Huff. This $3.2 million is an expenditure of grant funds awarded from the Oklahoma Healthcare Authority. And what this is going to do, as you guys know, we've been working diligently to revamp our contract health process. This $3 million is going to be hiring case managers at all the facilities that will help with the flow of patients as they're better coordinated inside of contract health as they're going from one of our facilities to a facility in Tulsa or Oklahoma City and back again. So this is just going to add a whole lot more staff into contract health to help our patients with that continuity of care. So I'll be happy to answer any questions.
Are there any questions for Mr. Terry from the committee? Are there questions from council online or in attendance? Hearing none, roll call vote, please.
Robert Huff,
Yes.
Mary Crawford,
Yes.
Anna Marshall,
Yes.
Leonard Gouch.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. NCA 22-140 is passed. At this time, I will relinquish the chair position to the vice chair, Representative Mary Crawford.
NCA 22-141, a law of the Muskogee Creek Nation authorizing the expenditure of tribal opioid response funds awarded from the Department of Health and Human Services, Substance Abuse and Mental Health Services Administration Center for Substance Abuse Treatment. Sponsor is Representative Joyce Steer.
Madam Chair, motion for due pass.
I have a motion for due pass from Representative Joyce Steer. Do I have a second?
Second.
Any discussion?
I would like for Mr. Terry to respond.
Thank you, Madam Chair. Thank you, Representative Deere. This SAMHSA grant is a 2-year grant of $1.6 million that's going to be used to fund help fund partly the 2 physicians that are doing our medication-assisted therapy, but the vast majority of this is going to be buying those medications like methadone and those drugs to replace those opioids. And that program has been significant inside of our nation. We have greatly reduced our opioid usage, and it's really becoming one of our model programs out there. And I'm happy to answer any questions if you have any.
Do we have any questions from the committee? Any questions from any representatives present or online? Hearing none, roll call vote, please.
Joyce Deere,
Yes.
Anna Marshall,
Yes.
Leonard Gouch,
Yes.
Robert Huff.
Yes.
Madam Chair, you got 4 in favor and 0 against.
NCA 22-141 passes. This time, I'd like to relinquish the services back to our Madam Chair.
Thank you, Representative Crawford. NCA 22-142, a law of the Muskogee Creek Nation amending MCNCA Title 15, Chapter 1, entitled Official Honor Guard, to establish a Women's Honor Guard and appropriating funds for the Estijati Hoktagi, I can't say this word, Saladawa Honor Guard, sponsor Anna Marshall.
Motion for due pass.
We have a motion for a due pass from Representative Marshall. Is there a second?
Second.
Second.
Second from Representative Crawford. Discussion?
Yes, Madam Chair. Several years ago, I attended the National Congress of American Indians, and they had asked they asked all the women who had ever served to come forward and to carry the flags. And I did not realize that there were that many women who had served in our nation's military. Not only that, but we know that the earliest documented record goes back to the Spanish-American War, when it started out with 4 Lakota women who became nurses in the U.S. military. And so based on that, and then just during the campaign, whenever I was running for council, was just meeting all the veterans. But then I noticed that there were a lot of women veterans that were not being recognized, or they didn't really speak out, or they didn't come forward. And then I saw some other groups of other tribes who were honoring their women with an honor guard or a color guard. And so they say timing is everything, and I think the time is now. And I really am excited to be able to introduce this legislation in honor of all the women who have served in the military from our nation. And I would like to ask Megan Lowry to come up and just share what this means to her.
Thank you for that opportunity. First, I want to say thank you all for even considering this. This is such a humbling experience. But first and foremost, I would also like to say that I just found out that we have 246 Muskogee women veterans that are alive and here. 246 people that have exemplary service. 246 women who had the call to service and followed through and have had some amazing accomplishments in their lives. My own accomplishment, I joined the Marine Corps and I worked at the White House. I did presidential security for President Bush. I've tucked all of that away. All of my presidential service badge, all of the awards that I've received, I've tucked all that away. So I just want to say thank you from the bottom of my heart for the opportunity to honor my home and my nation. By bringing this all up, from the bottom of my heart, thank you, Mado.
Thank you, Megan, for your service and for all the women who have served. And we know that we as a tribe, we're becoming more aware of your service. and all the sacrifices and the recognition of all your contributions to our nation and to the nation in its fullest. And so, thank you very much. Thank you, Madam Chair.
Thank you, Representative Marshall. Are there any questions for Representative Marshall?
Madam Chair, Speaker Lowe.
Yes, Speaker Lowe.
Yes, ma'am. I would like to become a co-sponsor. If I could ask the sponsor of this bill, as a Marine Corps veteran myself, I would love to be a co-sponsor if possible.
Yes,
Mado.
Ms. Marshall.
Yes, Mr. Speaker.
All right. Mado, ma'am. Mado, Madam Chair.
Mado, to you. Are there
Madam Chair.
Representative Hicks?
Yes, ma'am. I'd also like to ask the sponsor if I could co-sponsor this, being a Army veteran.
Representative Marshall?
Yes, Representative Joe Hicks. I would love to have you as a co-sponsor.
Thank you. Representative Thomasine Yehola Osborne.
Thank you, Chairman. I just have a couple questions regarding this legislation. I know that it might have been last year that I believe Grover Wynn was actually recruiting both female and male veterans for the Honor Guard. And so I just wanted to know what the separation was for this legislation between our female and male Honor Guard. And also wanted to find out if the budgets are the same for the Honor Guard, which is proposed for the female Honor Guard. And then also if the male, the Estujati Muskogee Honor Guard was aware of the changes to the legislation, because I noticed that there are changes for them also. Thank you, Chair.
Thank you.
The answer to the first question is on the upstart for the Women's Honor Guard. It is at a higher level for them to get organized and to get started. After that, they'll both be getting $40,000 each, so that equalizes out the budget. And as far as them being separate, I believe our women have served gallantly and that they deserve to have their own honor guard aside from the male honor guard. And we worked with Mr. Wynn and Rachel Riddle from the Veterans Affairs. And if maybe Mr. Wynn would like to address the part about your question about the separation, about did the Estujatis know about the women? So that would be a question I would defer to Mr. Wynn if he'd like to answer.
Thank you, Madam Chair and Committee. Yes, we were recruiting for both, but that was before we had a Women's Honor Guard and also a Men's Honor Guard. Back to your question, back to your position there, Councilwoman, I've been approached over the last several years about having a separate honor guard for the women. And one of the reasons, there's a couple of reasons for that. One is I reached out from some female veterans families who had requested maybe why we didn't have a women's honor guard. The other part of that is too, as we begin to ask our women veterans to come back, to be a part of it and everything, this was an area I felt like that would greatly increase our ability to recruit our women veterans coming back. I was down at Dewar Schools this morning, was asked to speak down there, spoke down there this morning, and I had an Air Force lady veteran come up today and was asking how she could be a part of this, and that she couldn't be here today because she had a doctor's appointment. But no, we don't intend to tear anything from our Men's Honor Guard. You know, it's done a superb job. I'm a full supporter of it, and always will be. But the other flip side of that too is, I think, in looking back, there were times when our Men's Honor Guard is so stressed because they're called so much. They're well known. They're asked, and sometimes we get in a situation where we don't. It'd be nice to have another honor guard to be able to send into some of these situations. A good example is right now, I have got 6 schools that would love for us to represent and somebody have an honor guard or somebody there speaking. We can't because I'm going to be in DC and honor guard's going to be with us. If we had a separate honor guard, this would be a case too that would be able to even help going into schools. The last year and this year, we have seen an increase in our school systems reaching out and wanting to know more about our Navy. Our native soldiers or native veterans. And so, yes, no, by no means would I ever try to take away from the men's because I'm a big supporter of that. But I really think I'm a strong supporter of the ladies too. I think it's a needed asset, and I strongly support both of them.
Thank you, Mr. Wynn.
Madam Chair, I believe there's enough room and space for all of us to be able to equally have space to be who we are in this nation.
Okay, one of the questions that I did ask, I don't think it was addressed, is the Estejati Honor Guard, are they aware of the changes in the legislation for them? It's not a whole lot, but I'm just aware if anybody visited with their Honor Guard.
They visited with Lloyd Thomas, so he's aware of the changes, and so they were closely worked out. As a matter of fact, the present legislation that you're looking at now, it has been updated and it's more relevant now than it was in the past. So a lot of clarification was done and a lot of things were worked out. So yes, Mr. Thomas was contacted. He was more than happy to help us with the corrections, and he believed that there was some clarifications that were made that were kind of vague, but now there's more clarity in that.
I appreciate it. Thank you, Chairman.
Welcome. Thank you, Representative Yahola Osborne. Are there any other questions from the committee? Are there any other questions from council online or in attendance?
Can I make a comment?
Yes, Representative Harjo?
Yes, ma'am.
Okay, go ahead.
My comment is I really like this. Holy cow. Whenever I joined the Marine Corps back in the day, the first person who reached out to me was a lady that worked for the public school systems that I really liked there in Waleka. And she was an older lady, and she invited me to sit down and eat lunch with her. And that was prior to me going off to San Diego. And she began to talk to me, and come to find out she was a former Lady Marine. And so this legislation come up, brought that memory back to me. And I think this is going to be a really good move for the tribe to do this, to honor our women, because, they served just as well as our men did. And so I'm happy and I'm very supportive of this particular legislation. Thank you.
Thank you, Representative. Are there any other questions? I have 2 comments. Or a question for Mr. Wind. Will these 2 groups always be separate, or will they ever join, or special occasions, or do you have any idea right now?
As far as individual groups, yes, they'll be separate. Now, as far as joining together, that would be up to the different or to either or of them. And I could see them working together in some different occasions. And I don't think I can't speak for them there, but I don't think there would be a problem. I think there would be facts about it in some of our meetings, and we even talked about there being some joint sessions where they were. We had a women's summit. Last week in Tulsa, and we were going to use our men's, and if we had our ladies, we'd use them. The Kiowa Honor Guard came down and graced us with their presence. While they were there, they also offered full support for our Honor Guard, and even, I think, left a video for you, is that correct? In support of it. So, yes, I think there will be times when they will work together. But again, that's, I can't speak for them other than just my thoughts.
Thank you, sir. My only other comment is to thank you all veterans for your service.
Yes.
It's a very appropriate time for this legislation. If there are no other comments, roll call vote, please.
Anna Marshall,
Yes.
Leonard Gouch,
Yes.
Robert Huff,
Yes.
Mary Crawford.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. NCA 22-142 is passed. And it will be sent to BF&J for funding source, I'm sorry. Next item is NCA 22-143, a law of the Muskogee Creek Nation amending MCNCA Title 37, subsection 2-123, entitled Estijati Veterans, Muskogee Nation, Honor Guard, sponsor Anna Marshall.
Motion for due pass.
We have a motion for due pass from Representative Marshall. Is there a second?
Second.
Second from Representative Crawford. Discussion. Any discussion? Hearing none, roll call vote, please.
Anna Marshall,
Yes.
Leonard Gouge,
Yes.
Robert Huff,
Yes.
Mary Crawford.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. NCA 22-143 is passed. We're down to other business. Discussion, health systems update. Secretary of Health, Mr. Sean Terry, and Health Systems Financial update, Chief Financial Officer, Mrs. Crawford. Mr. Terry, you have the floor.
Thank you, Madam Chair. Thank you, committee. I have, as always, submitted our monthly report in writing. We have electronically given a copy of this to April. For those of you that don't have a hard copy, it may be important for you guys, if you haven't received it, to get this from April this month. On the first part of the report, it talks about the bivalent COVID-19 vaccines, and it talks about people ages 6 months through 4 years and which vaccine is appropriate for those age groups and when to receive those. And it goes through people 5 through 11, ages 12 and older, and 18 years and older who have previously received a Janssen primary dose. And I know that a lot of you guys, I get phone calls and messages from talking about our citizens have questions about, is it appropriate for them to take a vaccine? When is it appropriate to take a vaccine? So if you don't have this chart in front of you, you're welcome to take this and reproduce it and give it out to people. It'll be helpful for you to know that. The public health activities, the mobile clinic, influenza clinic, we went to 20 sites within the boundaries to administer vaccinations to the public. We did over 900 employee vaccines for the flu over that month. We, this last month, held the 20th anniversary Pink Party at River Spirit. We had over 347 participants, so that continues to grow. The Department of Health represented the Mother-Baby program at the Okmulgee Community Meeting. This group of community leaders collaborated to provide support for sobriety, parenting classes, counseling services, addiction, harm reduction, supplies, and so forth. So that was a great event. On some of our external governmental activities, on October the 12th, we announced a partnership with the OU School of Medicine to provide general surgery services. This was a big move in our surgical program. As I've announced in the past, that we have bought the first ever tribal Da Vinci robotic surgical robot for Council Oak. We're going to be launching our surgery program for just colonoscopies next Monday, so we're excited about that. And that was a great partnership for us to announce. On November the 1st, the Department of Health leadership hosted the Indian Health Service Director, Rosalind So, at Council Oak. She was very impressed with the Muskogee Creek Nation, what we've been doing with our facilities and our growth, what we're doing with Spark, which is our contract health software. Second Chief Beaver came in and had good conversations with the director, and she's going to be inviting us back for more discussion about our software usage. So that was a great meeting. We are involved in the end stages of 2 major opioid lawsuits with 2 additional lawsuits pending. The attorney's estimate from the 2 major cases, compensation could reach an estimated of about $7 million to be used towards addressing the opioid crisis. We are also in the initial phases of getting our act together right now and opening the hotel at Council Oak. We have some things, some hoops we got to jump through. There's was some mold remediation in some of the rooms we wanted to get out of there. We're buying new mattresses. We bought new locks on the doors and all the things that we just make sure those rooms are clean and safe for our citizens when they're there. Ms. Crawford, I don't know if you want to come and talk at all about finance, or if you want me just to cover the highlights. We had a strong month financially. Third party continues to be strong. The year over year, our hospitals are about 16.9 million in the black, as opposed to this time, pardon me, this time last year, we were about 6 million in the red with the hospitals. So we had a very, very strong month. We're having a very, very strong year with the hospitals and the clinics because of our pharmacy refill center. This time last year, we were somewhere in the vicinity of about $8 million in the black. This year, it's, Brenda, I can't read that number. Can you read the number? 68 million in the black. So we're doing over 4,000 prescriptions a day, and that's really helped us with our revenue growth. And with that, I'll conclude my report, and I'm happy to answer any questions.
Thank you, Mr. Terry. Are there any questions for Mr. Terry from the committee? Are there any questions from council online or in attendance? Mr. Terry, I just have one question.
Yes, ma'am.
When we first started getting the COVID shots last year or late last year, and then we went into the booster series, I thought they told us to stay with, if you were Moderna, you stayed with Moderna shots, and then you went, or if you were Pfizer, you stayed with those shots. Now it doesn't matter.
Doesn't matter. This bivalent vaccine is different than the previous ones. And so it addresses both the Alpha, Delta, and the Omicron variant. And so I've taken the bivalent Moderna vaccine the first time I took all the Pfizer vaccines. This vaccine for me personally was, I got very tired when I took the first 2 vaccines. And I had almost no reaction at all with this one. I took the flu vaccine and the bivalent all in the same day. So this bivalent is much easier to take.
Okay, thank you, sir. Representative Yehola Osborne has a question.
Mr. Terry, I had sent an email to Chief Hill. It's been probably a few months ago now, but I had asked if and when the lab was going to be up and running in Wetumpka, as well as the X-ray.
Thank you, Ms. Osborne. We have fully funded those positions back and they're open. We're actively recruiting for those positions right now. So as soon as we get those positions filled, we're going to be fully staffing those back. As I had mentioned, I think it was last month, that our priority during the pandemic was to keep OKEMA open and to keep that lab going because we were running so many tests, and lab personnel was one of those. And so there's Wetumpka did get hit with personnel like we did throughout the system. We pulled those staff back to OKEMA, but we fully funded those positions. We're actively recruiting, so it will be fully staffed.
Thank you, Chairman.
Thank you, Representative Osborne. Thank you, Mr. Terry.
Madam Chair, could I mention one more thing?
Yes, you have the floor.
I apologize. I skipped right over this. For those of you that haven't heard, there is a lot of RSV in the state right now. We're seeing large amounts. We have about a 23% positivity rate of RSV inside of Creek Nation. We have COVID, which is about a 17% positivity rate right now throughout the nation, and we've got flu. So all of these are respiratory viruses with RSV hitting our kids. Even though adults can get RSV, they're typically more mild symptoms. And as you may have heard on TV, there are very limited beds throughout Oklahoma. When it comes to pediatric emergencies like this, typically St. Francis and the University of Oklahoma in Oklahoma City are the only two hospitals that have the capability of handling pediatric intensive care. Typically, if they bring those into our emergency rooms, we try to treat the patient with the symptoms. If they have a fever, if they have a cough, if they need a breathing treatment. If they get short of breath, though, that is the one thing with RSV that you need to really think about getting them to an ER as soon as possible. We have seen a lot of our transfers taking long periods of time, people waiting up to 8, 9, 10 hours, 12 hours to get those transfers until we get a bed out there. And as always, there are going to be kids that are more sick than others, and we have to triage those patients through. So I just want to keep everybody aware of what RSV is doing right now. And the state of Oklahoma has allowed hospitals to expand their bed capacity for kids if that is needed. So I apologize, I skipped over that, but I felt like this was important enough that we needed to make sure that everyone's aware of it.
Thank you, Mr. Terry. If
Thank
there
you,
are no
ma'am.
other questions?
Chairwoman Deere, this is Sandy Golden.
Yes, Representative Golden.
Yes, Mr. Terry, this is back to the Wetumpka Health Center, and you said that you were in the process of hiring someone for X-ray there. Is that X-ray machine still there, or did you get another one? Did you know?
No, I believe it's still, the one that was there is still there, I believe. I'm not aware that it's taken out.
Well, yeah, because when all the staff were taken out of there, it's been about 5 years ago, that X-ray machine was still there, and nobody could use it because there wasn't a person to operate it. And so they said that as soon as they got out of the contract, that it would be gone. And so not only, if it's 5 years old, is it still up to code like it should be? And who's been checking on it?
Well, GE has a service agreement on all of our machines. So before that we would X-ray someone, a GE tech, we would just call them in as they have our service agreement, and they would verify that it's ready to go before we X-ray someone.
So how do you know it works now if you have no one there?
I don't personally know whether it works or not if it's been sitting there, but we would have GE go in before we ran a patient through it. GE would go in and they would turn it on and make sure everything's working appropriately.
Thank you. Thank you, Madam Chair.
Thank you, Representative Golden. Thank you, Mr. Terry.
Thank you.
We're down to other business. I'm sorry, we're down to announcements. Are there any announcements from the committee? I would like to announce that we have an emergency meeting immediately following this meeting. So for those of you online, we'll say 5 minutes. Hopefully the speaker will be here in 5 minutes. And that's the only announcement that I have. For our benediction, I would like to request Anna Marshall do our benediction, which will serve as our adjournment. Please stand if you're able.
Let us pray. Creator God, we just want to thank you for all the blessings and for your guidance during this meeting. And we just ask that you just continue to just grant us wisdom and just grant us courage each and every day. And that you just lead us in the right way and give us the right words to say, and that we show respect to each other, and that we do our work with integrity. And we just ask all these things in your name. Amen.
Amen.
We are adjourned at 2:41 p.m. Thank you.